Turning now to medical rounds. Could the results of a recent study in the New England Journal of Medicine affect the future management of prostate cancer? Well, that's one of the questions we're tackling tonight in medical rounds. And joining us live is Dr. Stuart Kesler, a urologist at the Tallwood Urology and Kidney Institute. It's nice to see you again, Dr. Kesler.
Nice to be here. Thank you.
Well, September, as you know, is Prostate Cancer Awareness Month. So let's begin with this question. What are the signs and symptoms of prostate cancer?
Well, thankfully, most patients don't have any signs or symptoms of prostate cancer. If it's a late diagnosis or late onset in the disease, some patients can develop bone pain. Some patients can have urinary symptoms such as slowing of their stream or even difficulty urinating. But thankfully, the majority of patients, especially early on, do not have any symptoms.
Now, that brings me to the PSA test, the question about that and how that becomes so vital. There's so much conflicting information, though, about it. It's controversial. There's so many different opinions about the test. Why is that?
Well, I think the PSA test, to some extent, is a little misunderstood and also has limitations. So first of all, if you have an elevated PSA test, some patients equate that to a diagnosis of prostate cancer, which is not correct. There are a number of different things that can cause your PSA to be elevated. Also, if you are diagnosed with prostate cancer, unfortunately with a PSA blood test, sometimes we overdiagnose lower risk disease. And so we also have to have a conversation with patients sometimes that lower risk disease that may be diagnosed doesn't always necessarily mean that you have to undergo treatment.
And that's the key question next is let's talk about the study that found prostate cancer survival rates are equally high. The survival rates are equally high if you monitor the disease versus undergoing surgery. So what are doctors and patients to think now going forward? What do they do?
So the study that you referenced, it was just published a few days ago. And so first of all, in general, in medicine, we try not to make decisions based upon one study alone, but a whole confluence of studies. And this is a very important study nonetheless. And so this was a study out of England where they took 1,700 patients who were diagnosed with prostate cancer based upon a PSA, and they randomized them to 3 different treatment arms. One arm was surgery, one arm was radiation, and one treatment arm was active surveillance. And they followed them for an average of 10 years, which is very important because for prostate cancer being slow growing in general, you need a long follow-up to make some determinations. And what they found was the risk of dying from prostate cancer among those 3 treatment arms was similar. They also did find, however, that in patients who underwent active surveillance, they had a 2 times higher risk of progression of disease and risk of metastasis. So it is possible, and time will tell, that if those patients get followed longer because of those higher rates, perhaps they may over time have higher rates of death rates.
So it sounds like we need more study on this, but it's probably a good conversation to have with your doctor. We thank you so much, Dr. Kesler, for sharing this great information tonight.